Okay. Which of the following is the most appropriate initial management for this patient? Antibiotics, marsupials. Am I seeing that right? Marsupialization,
Yep.
incision and drainage, sitz baths, and surgical excision. Okay, a 32-year-old woman presents to her gynecologist with a painless, swollen mass near the vaginal opening that's been present for a week. She denies any fever, vaginal discharge, or pain. On examination, a non-tender, fluctuant mass is observed in the labia majora. The overlying skin appears normal. Non-tender, fluctuant. So I'm trying. Fluctuant means it's growing, or is it like moving when you touch it? Um, I'm thinking, and I'm not sure if I'm right, but I think it might be a Bartholin cyst.
Okay. Okay. I
Um,
like that you're committed to a diagnosis. Now, what do you want to
yeah, I'm gonna
do?
commit to it because I can't think of anything else it can be.
Okay.
Uh, let's see, incision and drainage, surgical excision. The problem is I don't know what two of those are. It's not antibiotics because a Bartholin cyst is not gonna need antibiotics. Problem is I don't really know what two of these answers are.
Okay.
Um, if it's yeah, I don't know why we would need to cut into it is the thing. If it's just painless. I don't know. I would probably guess the sitz baths, but I have no clue.
Okay, good.
There
So
we
that's
go.
right. Painless swollen mass, non-tender, likely a Bartholin cyst caused by obstruction of the Bartholin gland, leading to accumulation of secretion. So fluctuant means that there's fluid in it, right? You feel like
Okay.
it's a sack of fluid, right? Without any infection, includes conservative management of warm sitz baths to promote drainage, relieve discomfort. So just taking a warm bath, opening the pores, trying to kind of open everything up. Antibiotics, right? So Bartholin cysts can get infected. If so, you need antibiotics. Marsupialization, I mean, we use this term in surgery quite often, but it practically means, if you, I'm going to try to draw this as best I can. Okay. So if you have a cyst, right, that's circular,
Yeah.
right, um, it's like a pore that's clogged, right? So marsupialization is you create a pouch, right? AKA like a kangaroo, right? So
Yeah.
you cut this wall open, right? And you suture these walls down, right? So now it's a pouch, right?
Okay.
So anything that wants to try to collect, it just kind of pours out. That's marsupialization, right? Incision and drainage, right? You just make a cut, but no suture. So it'll drain out, but there's a chance that it closes again, right? And then surgical excision is you cut all of it out, right? I hope that
Yeah.
makes sense.
Yeah. No, that makes sense. Yeah.
Yeah. So just remember marsupialization, wait, marsupials, right? Like
Yeah.
kangaroos with pouches, right? So that's what
That's
it is.
exactly what I was thinking of when I read the word, but I never heard it.
Yeah. So there we go. Using, kind of learning some some prefixes to kind of figure it out. But yeah, so good. Sits back. So in your mind, you're thinking, okay, let me try to do something conservative because it seems like there's no symptoms, right? And it's the first time, so you can try that. So good.